CNN's Jeremy Diamond is live at the White House joining me now. We just heard from the president speaking to reporters as he was on his way out. Jeremy, he had a lot to say when he left the White House. What sticks out to you?
He certainly did, Kate, and one of the main questions that I and other reporters asked the president about was about these new models showing increased projections of number of deaths caused by coronavirus in the United States as some of these states across the country begin to reopen their economies. The president, though, seemed unfazed by that, and he claimed that these projections were based on no mitigation. Listen.
Well, it's a report, and that's a report with no mitigation. So based on no mitigation, but we're doing a lot of mitigation. And frankly, when the people report back, they're going to be social distancing and they're going to be washing their hands and they're going to be doing the things that you're supposed to do. We won't be going into stadiums full bore yet, you know, for events and soccer and football and all of the different events. Baseball, I hope baseball can get going. But they won't be going in full bore yet. At some point, hopefully in the not too distant future. But that report is a no mitigation report, and we are mitigating.
And now, Kate, the president there was referring to that Johns Hopkins University model, which the researcher in charge of that has said it was not complete, and he's not sure why it was included in this CDC and FEMA report that has been used internally inside the government. The White House, of course, has distanced itself from that. But I also asked the president, Kate, about the IHME model, which we know the White House has repeatedly relied on. And that report is showing a doubling of deaths by August to 134,000 deaths. The president also gave me the same answer there in talking about no mitigation. That's just not true, Kate.
That's right.
This latest modeling is not about no mitigation. It's about relaxed mitigation, relaxed social distancing, and taking all of that into account as some of these states begin to reopen. I asked the president also specifically about the fact that almost all of these states are reopening before meeting the president's own criteria for beginning to reopen. That is a 14-day reduction in the number of new cases. Almost all of those states that are beginning to reopen have not met that criteria. The president says that he's giving these governors a lot of leeway. He's going to be watching the situation closely, and he said if he sees something he doesn't like, that he's going to step in and intervene. Kate?
No, and Jeremy, you asked a critical question there, and I think let's hit on that just one more time. When you asked about the IHME model, this is the model that the White House has relied on and leaned heavily on all along. And they very clearly assumed mitigation, quite full mitigation at one point. And the reason the number is jumping, as you well pointed out, is because they're now accounting for states reopening and people not following the mitigation rules that are in place in the states that haven't even reopened. And he's still, I don't know if he didn't get it or didn't understand it, but he's got it wrong.
Yeah, he certainly does. And look, this is how the president has reacted to these models in the past, right? He likes to downplay them. He likes to look towards the modeling that shows a more positive trajectory. But we should know the IHME model has actually been among the most conservative in terms of projecting the number of deaths going forward. And the president, we know, has shifted repeatedly on the projections of deaths. A couple weeks ago, he was saying 50 to 60,000. Now that we are at about 69,000, the president is saying perhaps up to 100,000. The question that we didn't get an answer to, Kate, is how many deaths is the president willing to accept? And what does he see as kind of the trade-off here in terms of how many additional deaths can you accept in order to reopen some of these states early?